Good afternoon. New Mexico's largest hospitals are overwhelmed, struggling to find space for patients. Presbyterian and UNMH are now activating crisis standards of care, which means they'll be focusing on people who need help the most. News 13's Jackie Kent is live at Presbyterian at Central and I-25 with more.
This new standard of care means any procedures considered non-medically necessary could be delayed anywhere between 30 and 90 days.
The decisions we're going to be making are how do you get that patient to the best place for them to get care now? And even if it's not your own hospital, even if it's not UNM or Press. But again, it's not going to be taking away care.
Presbyterian is emphasizing that the hospital systems will not be denying care, but shuffling patients in Albuquerque to other hospitals in rural New Mexico or around the Southwest region. Doctors say this move is necessary now because both Presbyterian and UNM health facilities are running at more than 100% capacity with not much room to expand. Hospital volume continues rising because of increasing COVID cases and with non-COVID patients who may have delayed care throughout the pandemic. UNM Health says it has even built additional ICU capacity that continues to be stretched thin.
We need the ICUs for other kinds of patients also. So the community needs that we have for trauma patients or patients that might have a heart attack or a stroke that need an ICU, we need to ensure that that capacity is there for them too.
Only 17% of patients at UNMH have COVID. It's 20% for Presbyterian, with 25 patients in the ICU. Meanwhile, Loveless wouldn't say if or when its hospitals could implement crisis standards of care. 88% of their patients are getting care for something other than COVID. UNM says despite the increase in capacity, its staffing levels are actually up because they brought in an extra 500 travel nurses. For Presbyterian, it's an extra 300 nurses. Back to you.
Okay, thanks, Jackie. Now, San Juan Regional Medical Center in Farmington has activated crisis standards of care some time ago.